My name is Dr. Ian Storch. I'm a board-certified gastroenterologist and osteopathic physician, and you are listening to D.O or Do Not. If you are interested in joining our team or have suggestions or comments, please contact us at doordonotpodcast.com. Share our link with your friends and like us on Apple Podcasts, Facebook, Twitter, and Instagram. We hope you enjoy this episode.
My name is Hadia Tariq, and you are listening to D.O or Do Not. Today, for our episode, we are interviewing Dr. Harmit Kalia, who is a transplant hepatologist from New York. Welcome to the show.
Thank you for having me. Great to be here.
Happy to have you. So, starting off with our first question for the day, can you share with our listeners who may be unaware what transplant hepatology is, and for example, what kind of patients you see?
Great. Thank you so much. We all know medicine has sort of evolved into super specialization. So every part of the body has a team or a physician taking care of it. So gastroenterology over the years has evolved into different branches, and transplant hepatology is sort of a subspecialty of gastroenterology. And the kind of patients that we take care of are people with liver disease, any form of liver disease. And given that the word transplant implies, we also help patients who are in need for liver transplantation sort of evaluate them for transplant as part of a big team at a transplant center, and then also take care of them before and after transplant. We don't actually do the surgery. That's our surgical colleagues who do that. They're transplant surgeons, but we're the medical aspect of the team that takes care of these patients.
Do all gastroenterologists treat liver disease, and how is a hepatologist different than a quote unquote regular gastroenterologist who is board certified in gastroenterology, hepatology, and nutrition?
Right. So going back to my earlier point where there's a lot of subspecialization occurring in many branches of medicine. So in a gastroenterologist will go through 3 years of fellowship, learning from all aspects of the luminal tract, the diseases. Of course, liver plays a big role in their training. And then, of course, since it's a procedure related field, they do all kinds of procedures to help patients. So they definitely learn general hepatology. And if their training is at a transplant center, they get a fair amount of training of taking care of patients with liver disease requiring transplant and post transplant care. But then, like anything else, if you have an added interest in learning the specialty even further, you spend an additional year after gastroenterology getting this certification or fellowship, and then become that expert who focuses on liver disease. So typically, most gastroenterologists will take care of patients with liver disease, but if someone is in need for transplant, they typically refer those patients to a transplant hepatologist who has that added expertise, and we kind of pick up the ball from there.
Can you tell us about the challenges of joining a newer transplant center? Your title is the Director of Strategic Development and Outreach. So, can you tell us what this job entails?
Yeah, I look at it as an opportunity more than a challenge. New York City has many liver transplant programs, and everybody's trying to do their best in taking care of their patients. But for the longest time, there wasn't a program in Long Island. That's where our program is based in Manhasset. And I think it was great for the powers to be to come together and decide that a program is needed in Long Island because a fair number of population that lives in Long Island, their care was being provided in the city. So now, with our presence and a robust program that's transplanting many, many patients and with excellent outcomes, we're able to help these patients, and they don't have to travel far for their care. They don't have to go into the city. And I think with any new program, you try to, there's a fair amount of competition between programs, but at the end of the day, everybody's trying to do their best to take care of their patients. And my job entails, I have different roles, but of course, I'm a transplant hepatologist first. So I have my patients that I take care of. And then in terms of the administrative role, I help identify as part of a big team, I help identify where there's a need for us to open up a satellite office. And then between a handful of us, we go there and we take care of these patients. So again, patients don't have to travel far. And there are other aspects of the program that there are quality metrics that we have to keep because again, at the end of the day, transplant is a very highly regulated field and it's something that we think about on a daily basis. How can we do things better? And fortunately, I'm part of that team that helps to make some of those decisions so that our patients can have the best outcomes and we function well as a team. So I'm just very fortunate to be part of that team.
So now moving on to, if you could just share with us what a normal day looks like for you, if you could start in the morning when you wake up and take us through what your working role responsibilities are.
That's a tough one. Honestly, I depend on my calendar. When I wake up in the morning, I have to look which office I'm going to for the day, whether it's going to take me 15 minutes or an hour to get there. And I have my trusted colleague, my partner in crime, and my nurse practitioner who accompanies me. And we basically show up at this office and we have a full panel of patients that we see with all different diagnoses related to liver disease, and we try to help them throughout the day. That's for the time when I'm in doing office hours, which means I have weeks when I'm all outpatient, and then they have some weeks what we do service time. So the rest of the outpatient week, so I see patients 3 days a week. And then the other 2 days are filled up with a lot of program related meetings. All the things that I mentioned earlier require a lot of sort of input from different team members. So we often get together and we decide what the next step should be and whether it's an issue or whether it's a strategy meeting or whether it's patient care related. There's always a huddle. And that's what I love about my job, which is it's sort of a team sport. It's never you sort of making solo decisions about the program, and it's a lot of fun. It's a lot of fun those meetings because we're sort of providing a lot of value to the program. Those are my outpatient weeks. My inpatient weeks, we have a service in the hospital where patients get admitted to. These are patients who either need for a transplant, are on the transplant list, and for some reason they have to get admitted, or as I mentioned earlier, patients who may have been referred from another provider who they think patient needs a transplant and they're not well enough to do this as an outpatient. So we try to help these patients try to figure out what's upsetting their physiology and their anatomy and try to get them through the hospitalization and get them discharged. Or often they get a transplant during that hospitalization and we take care of them after the transplant. So we have a fairly busy service. And so in a multidisciplinary team setting, so we end up co-managing these patients together. We have fellows on our team. Sometimes we have residents and medical students. And there's a fair amount of teaching that occurs with clinical skills. And then there's also fair amount of procedures that we do, endoscopy, and this is where the fellows get their training and take care of these liver patients. So that happens for, I'm on for a week, handful of times a year because we have a big team and we all do service time. So it keeps, your clinical skills sharp because you're managing these patients in the hospital, they're acutely ill, but then you end up following them in the office on my other time when I'm in the office. And it's just a nice continuity of care. It's sort of getting them through the journey of, let's say, transplant, if that's what they end up getting. So it's very rewarding.
That's definitely a busy schedule.
Yes, my wife thinks so.
Do you find yourself working with other specialties often within this field?
Absolutely. We have the multidisciplinary team that I was talking about not only encompasses the surgeon and advanced practitioners, but as a part of managing those patients in the hospital or as an outpatient, we often get cardiology, infectious disease, nephrology, and other services involved to sort of optimize the patient so we can get them through the transplant process. So oh yeah, we on our conferences that we have on Fridays, which is our selection conference, those are the days we make decisions about patients' candidacy for transplant. We have over 60 people on that call from all different specialties, and they all sort of commenting on their role in managing the patient, and it's fantastic the amount of input that's needed to make sure that the patient is well served. And sometimes the patient is not a candidate for transplant for those reasons, and there are a lot of serious deliberations that require the input of these experts to help these patients. So definitely a meeting you can't just fall asleep during.
Absolutely. And I'm sensing there's quite a bit of an ethical component to it all too.
There is. There is. Transplant doctors are, many of us think ourselves as gatekeepers for these organs. I simplified for our patients and I say, someone else is dying at another hospital and their family has to make the decision of donation. And if things go well, and it's unfortunate to say well, but when someone else is dying in another hospital, they can pass on that organ or organs to recipients at other programs that are desperately waiting for those organs to survive. Kidney patients are waiting on dialysis for transplant. Heart transplant recipients are waiting in hospitals on multiple medications and devices. Liver recipients don't have any devices or any anything that they can depend on, so timing becomes key. So we have to make these decisions about whether someone is a good candidate, meaning they'll get the gift of life, but then they'll take good care of themselves. Yeah, ethics plays a big role, and yeah, it's always part of our discussion in the back of our minds. Do we think this patient will do well with transplant? So no, that's a very important part of transplant, is the ethics.
Absolutely. That's a very fascinating portion of transplant hepatology. So now it's kind of switching gears into the next question. As a practicing Sikh man in medicine, do you feel as though you faced any unique challenges? And if so, how did you overcome them?
I've been very fortunate from my journey, even before medicine. I just feel I look at everything as an opportunity. One very common Sikh concept is what we call Chardikala, which means positive attitude, meaning I always tell my kids tomorrow's going to be a better day. And that's how I was raised, and that's how we operate in my family. And so, if you get technical, there have been sort of disappointments in the past, but all those disappointments led to newer opportunities, new doors opened up for me. So I look at it as just perfect timing for whatever happened to me. And if I'm having a bad day, I know tomorrow's going to be a better day. So throughout my career, I feel that I've just been very fortunate where people have been very kind to me. So I always think of how I can pay it forward. So I love talking to trainees about some of the missteps if I had made them, so they don't make them. And have loved the opportunity today to talk to you guys about whoever's listening. Yeah, I think medicine is a great career. I think you can help a lot of people, and just you have to be honest with yourself, and you got to choose the specialty that has a true calling for you, as opposed to let me just chase a certain lifestyle or a certain financial aspect of specialty. I think as long as you're honest with yourself, I think you'll do great, and it's still a great noble profession. So I've been very fortunate thus far.
Yeah, I think one of the beauties of medicine is the opportunity for mentorship. And there's so many physicians out there like yourself who have experienced so much and are willing to impart your wisdom on the rest of us. So we really appreciate that.
No, great to be here. Thank you.
So, where did you go for undergraduate school, and were there any experiences there that led you into medicine or osteopathic school?
So I went to college in the 90s, and it was at Queens College. I'm local from New York, and it was a great experience. And I knew going into college that I wanted to be a doctor. I think I made the decision in ninth grade, and sort of just knew that biology was the right thing to do. I didn't even sit down with anybody to say what major should I be. Again, it was this inside voice telling me you're going to be taking care of people. You should at least know your biology really well. And I think it was just the love for anatomy, physiology. I had the opportunity to work as a TA in many courses that I took, and now I was teaching the lab. So that was a great experience. And in the 90s, very challenging to get into medical school. And I know every era they say that, but back then there was definitely, I think, a New York Times article about the ratio of kids applying versus how many were getting in. So again, you had that challenge. And I didn't know much about DO schools at the time, honestly. I knew I was going to apply to medical school and see if I could get in. And I remember talking to somebody, a friend of a friend, who at that time was a second year NICOM student. And he basically just, it was over a dinner one day, who basically said, consider it. And back then, internet wasn't as strong as it is now. But again, between whatever research I could do, I said, you know what? There's, I don't see a difference in terms of what you end up doing in life. And yeah, I applied and I got into NICOM, and I think the rest is history. I think it was a very interesting journey. I would say that back then, not a lot of programs knew about DOs. The first thing they would say, are you a bone doctor? Or patients would say that. I don't think that's an issue now anymore. This was like, I graduated 2001 from medical school, but I think it was sort of a collective experience between childhood, love for science in college, biology, and talking to somebody about a DO degree. I sort of fell into a DO program, and I guess the rest is history.
Absolutely. The DO profession has grown a lot since then, and it's
Yeah.
really exciting to see how far we're going to go.
I think when I applied, or when I got into med school back then, I think there were only 17 or 18 DO schools. And I know that number has increased significantly since then.
You've doubled by now. Yeah.
Yeah. Yeah.
Okay, so how was your experience during medical school, and did you have any special extracurricular activities or research that you were involved in?
All I remember is there was a lot of studying. There was a lot of, I just need to pass. I just need to pass. I think that's, every school has its own philosophy of how they want to impart the knowledge to, from the textbook and lectures to your students. I wasn't the type who would go to lecture every day, but I had friends who would give me the notes, and we weren't very dependent, or we didn't have access to technology. We didn't have streaming lectures, and we didn't have PowerPoint presentations, but somehow you figured out what was important to learn for each lecture, and you studied. And again, like, everybody has this story about how they got through med school. I got through as well. I think that my enthusiasm and fun really began when I started doing rotations, sort of what you're doing right now. I think you that's when you feel like, oh my god, the last 2 years have meant something. Otherwise, you're some classes, some subjects that you may not be interested in, you feel like you're just cramming them. But I again, I did my best to. There was really no, back then, the research really wasn't talked about, at least at NICOM. But I would say to students now, if you're interested in anything, you got to just do more than say I'm interested in it, you know. And I think showing doing research and adding to science, I think it's important. And there are different ways of doing that, I think, but often there's just no places that you can go to. But again, I think the resourceful students, between calling family members or the doctors they know in the community, I think they find access to research if your own school doesn't offer it. And but I would encourage you to do that too, because you end up learning a lot more than just what you learn in classroom. So I think that's great. And extracurricular activities, honestly, between sleep and spending time with family, I feel I didn't have time for anything else. I did have friends who were golfing, who were going on trips. Again, they were a lot more efficient than I was, but I have no regrets. I think we I did what I could to get through, and it was a lot of fun.
Med school is definitely memorable, but I think the studying is what we all remember the most.
We do, although it's now 20 plus years now since graduation. And I often say, I see my kids studying. I'm like, I wish I just had 3 hours to sit down and just read. And it's never 3 hours. It's always, well, I have 20 minutes to read this paper, or I have a talk coming up. Let me take an hour to put the slides together. This always feels rushed. In med school, that beautiful, I have 6 hours to study for this exam tomorrow. You appreciate it after it's gone. So for those listening to this who are still in medical school, enjoy the studying part because you will miss it. Once you get so clinically busy, you will miss the reading, or at least the time, I should say. So,
That's a really good point. What was your process of choosing internal medicine and applying for residency?
yeah, you take me back many years, and I had to think about this because there's there's so many specialties that come across you, and or growing up, you when you one decides to, hey, I want to be a doctor, there are a few things that come to your mind. And I always thought I was going to be a surgeon, a cardiothoracic surgeon. I got to tell you, that didn't last long because just though I enjoyed surgery rotation, I really felt my third year clerkships that when I got to internal medicine, it was just a very good balance of that cerebral nature of patient care, a lot of discussions between team members and education for the patient, and not just addressing one problem, but multiple problems, and then seeing the patient in the hospital, but then following up with them in the office, that continuity of care, and then being exposed to the subspecialties of internal medicine, like nephrology and infectious disease, and where you're like, wow, if I really liked one aspect of internal medicine, I could spend more time in it and become an expert. So it was sort of like a natural journey through those few weeks of internal medicine rotation where I just enjoyed every single day and taking care of all the acute and chronic problems in the hospital. And I think I never looked back. I never said, well, I have three other rotations left. I think I was fairly decided at that point that internal medicine was going to be my choice. And I started focusing on, as a fourth year, you had to do your sub-I, and starting to showcase yourself and getting ready for residency. Yeah, that's sort of how it evolved.
Yeah, it sounds like it really was a calling to you.
Sometimes you have to find your specialty, but sometimes the specialty finds you. And I think for the students who are listening to this, go with every specialty, every rotation with an open mind, because there's really, it's if it's done right, if you have a solid training program where they take medical education seriously and you have a good rotation, whether it's pediatrics or OBGYN or psychiatry or all the other specialties, I think you may not even say, hey, I'm not, you may say I'm not interested in this specialty, but you'll still learn something from it, and it'll help you decide your final answer. So yeah, it's definitely nerve wracking for some, but I think I was very fortunate that it came to me my mid year of my third year third year med school.
Okay. And that leads me to my next question, which is, as an internal medicine resident, how did you choose to specialize in GI, and what was the fellowship application process like for you?
Yeah, that was a separate journey. You start internship year, and it's a lot of it's a big change in your life. You suddenly are responsible for people, and although somebody would check your work, like your senior resident and your attending, but for the most part, depending on where you train, and if you have a lot of autonomy, you could do a lot of helping or a lot of hurting. Meaning if you make mistakes. So I learned fairly quickly in my internship year that it'd be a good idea to specialize, because almost every specialty that I came across, the ones that I mentioned earlier, and then the one that sort of initially I thought appealed to me, cardiology, was a lot of fun. A cardiology fellow sort of took me under his wing and said, "I think you'll make a great cardiologist." I don't know what he was looking at, but that was his assessment. And we did a research project together, and before you know it, we're submitting it for an abstract, and within a year we're writing a manuscript, and I'm all jazzed. But then, when you sort of started comparing yourself to some of the other residents who are truly interested in cardiology, I figured I'm not that phenotype. Meaning, someone may have seen something in me about cardiology, but that wasn't my passion. So after a year and a half of thinking I was going to be a cardiology fellow, I changed my mind, and I gave myself like a few months to just say, let me just keep doing the work here. I enjoyed ICU. I'm like, maybe I could be a critical care person or pulmonary. Again, a lot of things run through your mind because you don't want to lose another year in making a decision. And then out of nowhere, I did a GI elective because some other resident got sick, and they who was supposed to be on GI elective, and they basically told me he can't go, so you have to go, and they pulled me out of ambulatory. It was just one of those things where it wasn't even my choice. I had to go, and I actually really enjoyed GI. But this time I didn't rush into it. I did a couple of more months of electives in GI, and yeah, so this sort of took me into the following year, and then I found out that I was going to be a chief resident, which meant that I was going to apply for fellowship a year later, and was lucky enough to be mentored by a hepatologist. And again, it was one of these casual conversations in the emergency room, and I just thought, the advice that he gave me was, if you're gonna be a gastroenterologist, be one with an edge, be one with a super specialization where you can make a name for yourself. And he's like, hepatology is one of those things. And again, those words really stuck, and I started sort of going in that direction towards hepatology. And in the olden days, you could do hepatology before you did gastroenterology, and that was sort of my career path. I did a year of liver training, and then went back to do a GI training for 3 years, and yeah, never looked back. Focused on hepatology since.
Oh, that's really interesting that you had a bit of a flipped approach to getting specialized. Do you think having the hepatology training beforehand gave you a unique perspective on your GI specialization?
I think so. I think if you look at someone's CV of hepatology before GI, often it's thought that this person did this to get into GI fellowship because we know for the longest time GI fellowship has been super competitive. Even the year I applied, the first year I applied, I didn't get into GI. I had an extra year where I was going to be chief resident, but I felt that this is, it's competitive, but we should, one should do what they're interested in doing. And because I did liver after GI, at the end of my liver fellowship, I actually made a comment to my colleague. I'm like, do I really need to do 3 years of GI? Because I know what I want to do. It's just liver. But it brings up another point, which is the competitive nature of some of these specialties and what students and residents need to do to be competitive when they're if they decide to go for one of these specialties.
Right, absolutely. And as a seasoned hepatologist who's been working in the field for so many years, do you have any advice specifically for current IM residents who are thinking about GI or hepatology?
Yes, of course. The first advice is don't forget your day job. If you're a internal medicine intern or resident, that should be your focus. You have to be a good internist before you become a good specialist. So you may be attracted to a specialty, but if you don't do a good job in all your rotations as during your internship year and your senior years, then the that people are going to notice because again, the application process, everybody knows this, is such that you're going to need good letters of recommendation, and often for DOs, and this doesn't necessarily mean for all DOs, but often, at least from my era, the best opportunity to get into a fellowship was in the program that you did your residency in. Again, there's just so many people applying. The people that you work with in your hospital, in your university system, they know you better than someone else who's going to look at letters of recommendation and then choose you. So that's why it's so important that your residency, where you train, if you're at a program that has fellowships, that you do an excellent job being a great intern and a resident, so that when your program director or your chair of medicine sits down with you and says, what do you want to do as a career path? Then you can let them know your choices and they will support your application. And of course, it's the people that you're going to be working with. So, my case, it was gastroenterology. I spent a lot of time, obviously, during the electives, but also after hours doing research projects with them, stay late certain nights because they were doing a case. I went in and I watched, or if they needed a hand to go pick something up, a pint of blood or stat antibiotics. Again, you make yourself useful, but not because you want something in return, but because you love the environment so much that you do everything that's necessary to take care of the patient. And this is the specialty you've chosen. And people notice that. People notice that. And so every aspect of your application has to be pristine. You can't go back in time and change anything. But when you hear this now, or I'm sure this advice is fairly common, when you hear, do your best, you really have to make sure that every day you go to work, you do your best, that your patients love you, that you know your patients well, that when you present your patients to your attendings, that it's a clear and concise presentations, you know the data well, you've read up on your patients, and therefore you have good plans and you have good literature to support your plans. And when you are told, hey, this is not how I would do things, you take that constructive criticism and say thank you. And then you go back and you read more and you keep doing this every day, and you will separate yourself from general crowd. And those are the people that stand out, people who show interest, who are kind, who are polite, who are hardworking, who are helpful. And those are the people that we look for in our specialties. So, and of course, don't forget about hepatology. It's a very attractive field. We're definitely recruiting.
That's some very valuable advice that I think can be applied to not just those looking into GI, but any specialty within medicine. So thank you for that. So jumping off of that, given your experience in the field, what do you think are some possible reasons that someone who applies for a GI fellowship may be rejected as an applicant?
That's a great question. And I'm sure if you asked different program directors, and I'm not a program director, but if you ask different program directors, there'll be some commonality between what they say, along with some unique things that they say, because certain specialties, for different reasons, attract a lot of applicants. Gastroenterology, and of course, cardiology, whether it's linked to the downstream revenue that the salaries that people generate, I'm sure has part to do with it. But yes, interest is important. Candidate has to be interested, and they have to show that interest in different ways. I mentioned before how you have to be a good internist before you're a good specialist. You know, there sometimes you just don't have enough on your CV compared to the other people that are applying. We interview people, many candidates for GI fellowship now, and I'm noticing that there's some people, their CVs have manuscripts from dated from when they were in high school, meaning they were in summer programs, they did research, and they got their names. I'm sure they did hard work and they worked in a lab and they got their names on a paper. And then they've been sort of diligent about contributing, making sure that that is part of their CV that keeps growing over time. No two people will have the same amount of research. So that, I think, as soon as you get interested in a specialty, you should focus on working on a project. Often people sign up for too many projects and they don't finish them. And unfortunately, that has happened to me too when I was training, because you don't want to say no, but you got to be honest with yourself. Because remember, your primary job is to be a resident or an intern. So if you tell the attending who's working with you that I'm going to write up these 5 abstracts over the weekend, well, unless you have a built-in AI in your head, it's going to be it's going to be difficult. It's going to be time consuming, and you're going to be fatigued, and you're not going to do a good job. So don't take on more than you can chew while you are working on these projects. Then, I want to say luck sort of plays a role. We often hear that, some programs take, they have 4 spots for a fellowship. They'll take 2 internal and 2 external, and the 2 internal that are applying most likely are going to go to chief residence, because that's how, because chief residency, it's an honorable year. People spend an extra year, so not that they're rewarded for that year, but usually those people are the best candidates. So if a third-year resident's applying along with 2 chief residents, and their best shot is in the program that they're training, well, then it becomes difficult for that third-year resident to get that shot. So luck. And the flip side I've seen too, where there are no chief residents applying and there's only one person interested in, let's say, cardiology or GI, and they apply, they get it because they're great and they didn't have to do an extra year for chief residency. There are a lot of permutations to that answer. And then there's also sometimes you're just not liked. Takes me back to when I was applying, without mentioning names or ranks. I remember I thought I had a pretty decent reputation when I was applying, but there was this one person who did not sort of like me for one or many reasons. And that person was in a powerful position to take my name out of the. We didn't have a match back then, but basically, this person did not want me to get a fellowship. And therefore, the first year I applied, I didn't get it. I was fortunate to have other colleagues and attendings and leadership who liked me and saw something in me, and they supported me the following year, and I was able to get GI. But sometimes stuff like that happens behind the scenes and you're not even aware of it. So it's important to have a mentor. I think that's key, that you don't walk away from this podcast saying, well, this is the recipe of how I'm going to get into a fellowship or tough residency, a competitive residency. I think it's important to have mentor throughout life, and every level you engage with that mentor, and you basically they're never going to lay it out for you. I think you're going to still have to do the hard work, but they will. A good mentor will give you enough challenges, but will help you uh, clear those challenges because you're going to be doing the hard work. And I've been very fortunate to have great mentors over the years who've helped me. They've opened a lot of doors for me, and that's why I sometimes go out of my way to help people because they deserve it. Because that's how things happen in this world. So, yeah, it's a very long answer, but it's complex because there's no straight cookbook to getting into the right fellowship. I think it's all those variables play a role.
I think that's a great answer. As much as we wish that there were clear recipes or cookbooks out there on how to succeed or get into specific fields, it is helpful to know what boxes, so to speak, you have to check. And I think that gives a lot of guidance to people who are interested in that field. So thank you. Do you have any advice for DO students who are interested in pursuing hepatology?
Please come join us. Well, there's a serious need for hepatologists. Liver disease is there's just vast amount of it, unfortunately, between alcohol liver disease and what we used to call just simple fatty liver disease, now called steatotic liver disease. Of course, viral hepatitis and liver cancer. Every Almost everything is on the upswing, which means that we need more and more providers to take care of these patients. I think I happened to, it was sort of an accident that I became a hepatologist. I initially thought I was going to be a cardiologist, but that didn't pan out because I don't think I was truly interested because others thought I would make a good cardiologist. I certainly didn't think so. Thank God for that. And then I was talking to a hepatologist one day in the emergency room trying to admit his patient, and he took an interest in me and started talking to me about the field. And he said, if you're going to be a gastroenterologist, try to have a focus on something. Otherwise, you never know how whether technology may dilute your career into something else. So that's why I did gastroenterology and hepatology. So I think it comes down to interest. I think students who like medicine, students who may be interested in doing some procedures, they like maybe they are interested in all aspects of medicine. Like we do a lot of nephrology and ID as part of transplant hepatology. Um, so this and people who like working with other people, not just doing it alone. We as I told you earlier, we have a multidisciplinary team. So I think if all these things appeal to you, try to do an elective at a program that offers a transplant hepatology opportunity for students, or when you're doing internal medicine, do an elective at hopefully you're at a center that offers transplant and you can just work with them. So I think you want to work or do an elective and really get to see the work, the day-to-day things that we do, what's bread and butter, what's complex, what's what are those meetings like where we make decisions about patients' candidacies. If all that stuff appeals to you, then I think the answer is just say, sign me up. It's 3 years of internal medicine, 3 years of gastroenterology, and then 1 year of transplant hepatology fellowship. Although many programs now, if you know up front that you want to do transplant, you can take a year off your GI fellowship and do 2 years of GI and 1 year of transplant hepatology as a combined program. Many programs are doing that. Again, the details can come later, but the interest has to be there. If you love the things that I talked about, at least do an elective and see if it's still there. That's how we choose our specialties, right? We go through the basic core specialties and then we try to figure out what kind of doctor do I want to be. I think I think you'll have a very rewarding career if you become a transplant hepatologist.
Absolutely. That's good advice to try and experience it instead of reading about it because it doesn't give you the full picture ever.
Not at all, yeah.
Mhm. Can you tell us one thing about you that has made you successful, aka what is your superpower?
Green juice. No, I would say it's probably patience and maybe just the I like to network. So if I'm interested in something, it's okay if it doesn't happen right away. I'm fairly patient. Things like career development has taken its time over the years, but that's okay because that's my journey, and I do feel that it has helped me. And along those lines, I think talking to people and meeting them and learning from them. I think listening is also a very good skill to have because when someone else is talking, it's important to listen. You never know how that knowledge is going to help you in the future. So I think over the years, I've been able to develop a network of people. Either they've trained me or I've trained them, and we've just remained in touch over the years. And it's just helped me just just be part of this big community. And it's always good to have information whenever whether you're referring somebody to a program for a position in terms of they want to work there, or you're recommending a resident for fellowship. I feel that networking ability helps you. So I've been very fortunate that people like to talk to me and I like to talk to people.
Absolutely. That's such an important skill. A follow-up to that is, do you think that's something that you've worked to develop over time, or were you just always naturally really good at connecting with people?
I think it's both. I think whenever you think you're good at something, there's always someone else you can look at conferences, or you meet people and you say, well, I wish I could improve my skills because that person up there does a lot better than I do. I observe people when they're talking to others, not like it's not creepy or anything. It's just I like to listen to people give a good presentation. And then when I give a presentation, I'm like, again, I could do this better. I could do this part better. I could be a little bit more. I don't have to always go 20 minutes over. When it's a 1 hour lecture, you should really finish at 50 minutes so you have 10 minutes for question and answers. Things like that. I kind of pay attention to those things. And maybe I'm a little critical of what I do and I try to improve myself. So, yeah, I think those are some of the things I focus on.
So that leads me to my next question. I know you have a very busy schedule. How do you obtain a work-life balance? What are your hobbies?
Wow, I think that should have been the first question. It's the most important question. It's very challenging. I think when you enter this field, if, I mean medicine, I don't mean just transplant hepatology. I think everyone feels overworked. I think burnout is a real thing. It's not just something to talk about. I think, and the only way to sort of take care of yourself is to actually take care of yourself. I think because no matter what system you work for, the work is always going to increase. I think documentation takes up a lot of our time. I think the expectations that patients have, which rightfully so, they're sick, they want to spend time with you, but you have a full room of patients waiting for you. You can't spend like 2 hours with each patient, but you can become good at making them feel that you spent a lot of time with them by having them actively listen to you and give them tasks to do so that they feel that they're part of their care. But when you go home, whether it's the drive home, whether it's your home, you have to be present what you're doing. Taking care of your body is very important. I think physicians tend to, we always say physicians tend to be the worst patients because many of us don't take care of ourselves. We think that these diseases are not going to impact us, it's only going to impact patients until you get your first cardiac event or your first malignancy, the common things that happen to the general population. So I think exercise is extremely important. I think nutrition is very important. I think sleep is very important, the basic stuff that we tell our patients. And I think in med school, you kind of let yourself go. I know so many people, including myself, who put on a lot of weight during medical school. And then you kind of burn it off in residency because you're running around. But but again, these things tell you that no one else is going to do the work for you. Just like you tell your patients, you need to make sure you lose weight, eat healthy, and sleep. Basic stuff. We're not asking about climbing Mount Everest or anything like that. I think those are important things that help in preventing burnout. I always, as I mentioned earlier, I'm always thinking about what am I doing wrong? Why is it that the next person is so efficient? Why can't I be that efficient? And then you look at details and you look at what that person may be doing this, they may be taking a shortcut here, and I don't like that. But it's important to ask yourself the question, why are you spending so much time in the hospital and the others aren't? And there's a balancing act here. So I think this work life balance begins with you asking the question to yourself, what's important to you? Like for me, family time is very important. So like right now, after we get done with this, I'm going to go downstairs and spend time with my family. And you can't bring work home, but then think about home all day when you're at work. It's again, I'm talking about a lot of things here, but it's because it's challenging. I have good days and I have bad days. Some days I feel like, hey, this is easy. Anybody can do this. And some days I feel overwhelmed. But it's okay. It's okay as long as you're trying every day to take care of yourself. And for all those listening to this, really the main message is take care of yourself because otherwise the disease does not discriminate. It can happen to any one of us. So and as a community, we should take care of each other, support each other. And if someone else is having a bad day, maybe you can help that person out by taking a couple of patients off their panel or again, there are different ways of helping. So yeah, but you guys, your generation's very smart. You guys entering this field with a lot of lifestyle questions already in mind. So I think you'll do a lot better than our generation. So, but only the best to you guys.
Yeah, medicine doesn't discriminate in that either, but I agree. I think burnout is a community effort. We all have to try to help each other as much as we can. And that leads us to our grand finale question, which is, what was the best piece of advice you got throughout your education and training, and what would you like to share with our listeners?
The best advice I got was when I was an intern. It was July of my internship year. I think it was my third week on oncology wards. And this oncologist who actually I invited him to my wedding because I loved him so much. He once stopped me in the hallway and we were talking about a bunch of patients. And then he, he basically said to me, it's going to get better. Just don't take shortcuts in life. Meaning, whatever you're working on, learn it well. we're not always going to be med students. We're not always going to be residents and interns. Your journey is going to go on, but if you don't take that journey seriously, and now you are an attending somewhere and you're responsible for taking care of patients, and you feel you're not well trained, well, then your patients are going to suffer. So I think it just, as if it happened yesterday, he said, do not take shortcuts in training. And that's when I tell my trainees, fellows and residents, is that yes, things may be hard right now, but you're going to get through this. But don't take a shortcut. You need to learn how to do this, whatever it may be in front of you. And I think, for all those studying right now, for all those taking a break and listening to this podcast, and it's good. You're taking care of yourself. But remember, when you come to work, whatever is in front of you, learn it well. I think it'll not only help your patients in the future, it'll help you because you'll feel that you made a difference in someone's life.
That is some really good advice to end this episode on. Thank you so much.
Oh, my pleasure. Thank you for all your time.
Absolutely. Thank you for joining us on our show. It was lovely hearing your story.
This concludes our episode of Do or Do Not. Send all inquiries, comments, suggestions, and even let us know if there is someone you want us to interview to doordonotpodcast@gmail.com. Don't forget to like us on Facebook at Do or Do Not Podcast for updates. If you enjoyed our podcast, please share it with your classmates and administration. We have plenty of more interviews lined up, and we're excited to share them with you. This is Tian Yu Shea. Thank you guys so much for listening to Do or Do Not.